Have you ever experienced a dull ache or sharp discomfort in your upper back that just won't go away? Whether it's from sitting at a desk all day, lifting something heavy, or even stress, upper back pain is incredibly common. But here's the good news, you don't have to live with it. In this video, I'm going to help you understand the causes of upper back pain and share simple, practical strategies to relieve it and keep it from coming back. So let's get started. But first of all, I'm Yogi Aaron, and I'm a muscle specialist passionate about helping you move pain-free, live stronger, and more importantly, feel confident in your body. Whether you're struggling with pain or just want to improve your posture and mobility, I'm here to guide you on this journey. The upper back or thoracic spine is a complex structure that includes your spine, muscles, and connective tissue. This area is responsible for supporting your posture and enabling movements such as twisting and reaching. Upper back pain often manifests as stiffness, a dull ache, or even sharp pain between the shoulder blades. It can be caused by poor posture, muscle strain, or even stress, which leads to tightness in the muscles of the upper back. Common culprits include prolonged sitting, repetitive motions, or carrying heavy loads. People who work desk jobs or those who perform manual labor are especially prone to this type of discomfort. Understanding what causes upper back pain and how it impacts your body is the first step towards finding relief. So let's explore how this pain affects your movement and overall function. The upper back is supported by several key muscles, including the trapezius, rhomboids, and erector spinae. These muscles work together to stabilize your spine and enable movements such as pulling, lifting, and maintaining an upright posture. When these muscles are strained or overused, it leads to pain and stiffness that limits your range of motion. Poor posture, such as slouching or hunching forward, is one of the biggest contributors to the strain. Over time, these issues can lead to compensations in other areas, such as the neck or lowering back, or creating a chain reaction of tension and discomfort. By understanding how your upper back functions and what stresses it, you can start making changes to support better movement and reduce pain. Upper back pain is often triggered by a combination of factors. Here are the most common causes. Number one is poor posture, prolonged slouching or forward head poses, tech neck. Number two is muscle strain, overuse from repetitive motions such as typing or lifting. Number three, stress and tension. Emotional stress can lead to tightness and pain in the upper back muscles. Number four, inadequate support, sleeping on an unsupportive mattress or sitting in a non-ergonomic chair. What are some of the early signs to watch out for? Well, they include tightness or stiffness in the upper back, especially after long periods of sitting, sharp or aching pain between the shoulder blades, difficulty moving your arms or twisting your torso without any discomfort. Recognizing these signs early can help you address the problems before it worsens. Managing upper back pain doesn't have to be complicated. Here are some simple but effective strategies you can use every day. Prioritize posture. Keep your shoulders relaxed and your spine neutral and your head aligned with your body. Use ergonomic tools such as adjustable chairs, and my favorite, adjustable standing desks. Move it out. Try gentle movements such as cat-cow, dynamic thoracic twist, or some muscle activations for the hips to release tension and improve mobility. Take movement breaks. Set a timer to stand, activate, or walk around every hour. to avoid stiffness. Apply heat or ice. Use heat packs to release tight muscles and ice to reduce inflammation if the pain is acute. Strengthen your upper back by incorporating exercises such as rows or scapular squeezes to build resistance and improve your posture. With these strategies, you can reduce pain and support a healthier, more upper mobile back. Now, my favorite is to debunk some myths. So let's address some of the myths around the upper back. Myth number one, upper back pain is just bad posture. The reality is, while posture is a major factor, stress, muscle strain, and lack of movement also play significant roles. Myth number two, rest is the best solution. The reality is that while rest can actually help acute pain, staying active with gentle movements is the key to long-term recovery. And myth number three, you need expensive equipment or therapy to fix it. And the reality is that simple movements and muscle activations and ergonomic adjustments can make a huge difference. Understanding these myths allows you to take a proactive approach to managing your upper back pain. Some of the muscle activation exercises that we're going to be doing to address the upper back pain, some of them we want to address our core muscles. So first of all, we're going to activate the core, and then we're going to start looking at the muscles that are responsible for stabilizing our upper back. So let's dive into some of the muscle activation exercises that we can do to minimize our upper back pain and, more importantly, start activating our muscles. One of them is our core muscles. So let's start by coming onto our back, and we're going to start to address our core muscles. There's a couple of ways to do that. One of my favorites is just simply hugging your knees into your chest. Don't use your hands to pull your knees in, because that's not going to do anything for your muscular system. You actually want to feel like you're pulling your knees in, and then lift your head up towards your feet. So think about your knees a little bit apart, pull your head up towards your feet and lift everything up. And you're going to feel all of your muscles right from your throat down to your groin activating, and then slowly come on down. And what you want to do is do that for 6 seconds and repeat it 6 times. So hug up as much as you can, reach the hands for the end of your mat, bring your head towards your feet and hold it there for 6 seconds, and then slowly come on down. Take a breath or two here, and then come on up. Bring your head towards your feet. Beautiful. And then come on down. Again, do that for 6 seconds and repeat it 6 times. Another one of my faves is to bring the knees above the hips, bring the hands towards the knees, and then press the knees into the hands here. And this, again, you're going to feel this, especially in your lower core. It's a great way to activate the transverse abdominis, even the obliques, and some of the trunk flexor muscles, and then come on down. Again, you hold this one for 6 seconds and repeat it 6 times here. All right, friends? And so just, you can do that, make that part of your program. One of the other ones that we want to do is start to activate our upper body muscles, even our lower back muscles. So Shalabhasana is always a good staple. Your upper back strain is probably happening because your lower back muscles are not working. Just simply lift the legs off the ground and lift the head and chest off the ground, and you're going to feel your back muscles starting to work here. And then come on down. And then do it again. Lift up. And hold this there for 6 seconds and repeat it 6 times. I'll do it one more time just to show you. Lift the legs, lift the chest, feel all the lower back muscles working, even some of the upper back muscles, and then come on down. Now, to activate the upper back, What you can do here is lift up as high as you can in the chest and then rotate one side. And this gets into a muscle called the semispinalis thoracis specifically, but you're also getting into other muscles as well. And then come on down. Keep the glutes as soft as you can here. So you're really isolating the upper back muscles. So you come up as high as you can, and then you rotate. And then come on down. That will really start to work the upper back muscles. Again, 6 seconds, 6 times, and then repeat the other way. All right? The last one that you're gonna do here is just simply lift the arms up as high as you can, turn the palms forward, and then slowly bring the arms to about 45 degrees, and then drive the thumbs up, and then slowly bring the arms back. And then do that again, and bring it to about 45 degrees. Go really slow, hold it there at 45 degrees, lift up as high as you can. You're gonna feel this in your trapezius muscles now. And then very slowly start to bring the arms back. Do that 6 times. And that's going to have a really incredible effect on the upper back muscles. You're gonna start using them properly. This little program that I gave you will start to yield incredible results. Probably within a day or two, you're gonna notice a big change in your upper back pain. Your upper back plays a vital role in supporting your posture and overall movement. By understanding its function and taking small and incremental steps to improve it, you can reduce pain and feel stronger every day. Remember, progress takes time, but taking the small and incremental steps adds up. Friends, if you found this video helpful, please comment below and let me know how it's helped you, or what other exercises or practices have you found to reduce your upper back pain. Remember to share this video with those who might be suffering from upper back pain, and remember to subscribe to get more helpful tips so that you can live your best pain-free life.